He is Dr. Ingo Mahn. He's the owner of Natural Dental Partners, dentist. With over 40 years of experience, Dr. Mahn founded Natural Dental Partners in 2017. After leading integrative dental solutions in Wisconsin, his passion is providing patients with dentistry that supports both oral and overall health. He's going to be talking to us today about breathe better, sleep better, and live longer. So please welcome Dr. Mahn to the stage.
Well, thank you. Oh my God, I love. Thank you for this awesome reception. I love talking. I spoke at RADFest, and I love Jim and his mission and what we're doing. And so what I'm talking about today, I think, can really be something that adds a lot of value and a lot of kind of foundational value to what you're trying to accomplish. And it's something that not a lot of people are talking about. And I know that all of you know Brian Johnson, and actually right before RADFest, one of my doctors had shared this video. Is my clicker working? Yeah. There we go. So, I just need sound on that. Are you able to do the sound on that? But you can always read too if you can. We forgot to test that part. We tested everything else. But he's basically saying how sleeping is such an underrated part, and in our society, if anything, we tend to kind of say that not sleeping is kind of this flex, like people almost brag about, oh, I could buy on 3 or 4 hours of sleep, and I sleep at my desk and I still get all this stuff done. And he talks about how he called sleep the most potent drug that we have. Yeah. And so I thought I just thought it was a very fitting statement, especially since he's spoken with you, and he obviously takes all of this measuring and takes all the longevity to really to a very high level. And so the fact that he's come out and said, hey, to me sleep is maybe the most important thing that I do, I thought was pretty telling. And of course, one of my mentors said, our lungs are our roots. Like, our lungs are to us what roots are to plants, and yet do we pay attention to it? And do I need to point this at a certain area? It was working earlier. So, when I was writing my little booklet, I kind of came up with this concept of a longevity or a health pyramid. And obviously we know the food pyramid is kind of messed up, and it's not what you want to follow. But I think about, like, when we think about our health, we tend to think about, oh, I'm going to take these supplements, do these different therapies, do things like RADFest, to take things really to that next level. But how many times do we look at sleep and breathing and oxygen? And to me, that's really the very foundation of our health. And yet it's kind of I call it the medical no man's land. Doctors kind of think everything north of the neck belongs to dentists and ENTs. Dentists kind of just want to deal with teeth, and ENTs just want to pretty much just do sinus surgery and take out tonsils and adenoids. So the airway itself is something that's not really talked about. And so they don't address airway issues. They don't look at breathing issues. They pretty much just look at, okay, are you an apnea patient? And so they don't, because they don't have a solution for the problem. And so they don't look at sleeping and breathing issues until they're really far advanced. So I just want to kind of clarify one term, because one of the things, if you look at sleep and sleep studies, they use an index called the AHI, the Apnea Hypopnea Index. And that's essentially how many times an hour do you stop breathing for 10 seconds or more, or your blood oxygen drops by 3% or more. And so that's kind of the whole index by which medicine works. So their question is really, is the AHI high enough for you to get coverage for CPAP? Because that's basically their solution. Let's wait till it gets really bad, and when you stop breathing, essentially 30 times an hour or more, that's now considered severe. And at that point, you're able to get insurance coverage, and they're like, oh, lucky you. Guess what? You now get a CPAP. But they don't have anything to deal with when you're at that milder stage. It's essentially just, come back when it gets really bad. And, I thought about that, 30 times an hour. I mean, to me, if I stopped breathing more than 5 times an hour, that I would consider that, severe. So the thing about, we really look at not something called sleep apnea, we look at sleep disordered breathing. So we're thinking of sleep issues as a spectrum, because we don't wake up one day, we're not perfect breathers, and then we wake up one day and go, oh, now you're a sleep apnea patient. And in fact, when you start treating airway issues, you find a lot of these issues, there are some that are age-related, but a lot of these issues people start sharing things about, as kids, not being able to breathe and having all of these issues. And once you start researching it, you realize a lot of this ADHD and behavioral issues, when we fix that in children, it's like you get a different child. And that's really, I had a conversation with a dentist about that. That's what got me interested in airway. But everybody's looking for the kind of the overweight, middle-aged guy with a tree trunk neck. But there's conditions like Upper Airway Resistance Syndrome, UARS, that's kind of called the disease of young fit females. So it's a spectrum. And again, why are we waiting until people get sick and get so bad? So I call this kind of the pandemic in our country. This is sleep disorder breathing. Probably about 50% of the population suffers from anywhere from mild to severe sleep disorder breathing, even before they get to the point where they have sleep apnea. And so again, we're looking, and people are like, well, if it's not sleep apnea, what's the big deal? Well, it really has to do. I love this picture. This actually won the National Geographic Picture of the Year. This is an Arctic fox about to eat this little marmot, and really, that's what our autonomic nervous systems are going through. From an evolutionary standpoint, we were never meant to deal with these collapsing airways, so our body is kind of this on-off. It can't tell the difference between being chased by a saber-toothed tiger or restriction to airflow. So our body responds in a way that's not appropriate, and we basically spend, our pretty much the whole night in this fight or flight. And I just want you to notice the amazing Photoshop I did turning that little marmot into a sleep apnea patient. And of course, with these conditions, it's not just always the person that's suffering from it. A lot of times, you think about the sleep partner, whether it's snoring, all the restlessness that's associated with that. It ends up affecting both sleep partners. So, and that's what people, sometimes don't understand, because they might be sleeping, but the question is, are they getting good quality restorative sleep? Because when we talk about nutrition, do you tell anybody, yeah, I ate 3 plates of food yesterday? Like, what? It's like, well, what was on those plates, right? Were you eating a bunch of Snicker bars and chocolate chip cookies, or did you eat something healthy? And so we really need to kind of be talking about sleep the same way. So it's not just how much time are we spending sleeping, it's are we getting into those proper stages of restorative sleep. And I'll talk a little bit more about what happens during sleep disorder breathing that prevents us from getting into those proper stages of sleep. So what are some of the consequences of sleep disorder breathing? Well, when I first started getting into this, one of my first mentors said, he was a dentist, and he said, when I look at patients, when they have a bad health history, my first reaction is always like, show me this is not an airway problem. And I remember at the time thinking, well, that's a pretty strong statement. But once you start digging into this and you go down that rabbit hole of trying to fix people, you realize he was absolutely right. So I'll just kind of show you, you can go on PubMed and put in sleep disorder breathing, and pretty much just put in the condition of your choice, and they're now showing that there's research connecting those. For example, fibromyalgia, they used to think, which is not even a disease, it's basically just a Latin translation of people saying, my bones and muscles hurt, because they don't really know what causes it. Well, it turns out, and they used to think, well, these people are in pain, so it's preventing them from getting good sleep. Well, it turns out that sleep actually preceded pain, so not getting into deep sleep actually causes that type of pain. Depression, this study talked about how those symptoms are very similar. And what's the first thing when a patient comes in, they're depressed, what do the doctors want to do? They want to stick them on antidepressants. Well, what does that do? They're respiratory depressants, so they actually make the sleep worse, which in turn makes the depression worse. So one of the things I kind of found as I'm studying this, a lot of the things that sleep makes worse in turn makes the sleep worse. So it's this kind of this vicious cycle. And if you don't address it, people are extremely frustrated trying to get healthy when nobody's looking at this. Immune function. It says, all available studies show that obstructive sleep apnea has an impact on cellular immune system. So this is like a completely systemic problem. Same thing with hypertension. Proper nasal breathing and proper breathing leads to, if you breathe properly through your nose, you're producing nitric oxide. So when you're breathing through your nose, the air goes across the turbinates, you warm and humidify the air, you produce the nitric oxide. And nitric oxide is critical. It acts as that vasodilator, it facilitates actual transport from the oxygen into the cells. Because it's not just about how much oxygen you have in your bloodstream. The question is it actually getting into your cells? And that's where, I don't know if you remember back in the old days when people had panic attacks because they weren't getting enough oxygen. We didn't put an oxygen mask on them. What did we do? Exactly, a paper bag. We had them, so when we breathe incorrectly and we have this shallow breathing, we're actually blowing off the CO2, so your body's going, oh, you have plenty of oxygen, I don't need to transport anymore into the cells, and that's how you end up getting that oxygen deficiency. So CO2 and nitric oxide are extremely important, and it has antibacterial and antiviral effects as well. There's actually, if you want to learn more about this, there's a guy named Nathan Bryant that has an amazing webinar on this. It's about an hour long. It's if you go on YouTube and put in full script Nathan Bryant, he has a great presentation on that. Diabetes. Snoring is associated with the development of diabetes. Like, who knew? Obesity. We have a lot of patients come into the practice and they talk about this unexplained weight gain. I think I had 3 patients last week where a woman said, if you saw what I ate, you think I'd be like 100 pounds. And yet I'm struggling with my weight. Well, it turns out that poor sleep, because everybody thinks, well, if you're on the heavy side, that makes your sleep worse. Well, again, it turns out that poor sleep causes people to make poor food decisions. They actually have done studies on that. It affects leptin and ghrelin, appetite suppressing and control hormones. That cortisol, that increased cortisol that you're supposed to, when you put your body into fight or flight, that cortisol releases blood sugar. You're not supposed to be running or fighting something, not laying in bed trying to fall back asleep. So if you wake up at 1 o'clock in the morning, it's not just something woke you up and you're a little disturbed and you go back to sleep. No, your body, you've been waterboarded by your own tongue, your cortisol's up, your blood sugar's up, and you're ready to do stuff. And now it's like, okay, good luck trying to fall back asleep. So, and even improper breathing can have an effect on the weight. So, you see all this stuff, you're like, okay, wait a minute, like, is this something that I might have? Well, the good news is that it's actually relatively simple to see whether or not this is a problem. So this is one of the forms that we use in our office. And really just I'll show you some of the cool tools that we use for kind of assessing our patients. But the truth is, if a patient just fills out this form and I talk to them for 5 minutes, I can pretty much go, okay, I know exactly what the rest of your health history are going to look like, what your sleep study is going to look like, because that same pattern, you see it over and over. So as a dentist, I really kind of am in the prime position to really diagnose these problems, and that's kind of my other mission, is to educate dentists on this. And airway, it's kind of nice. Airway is the hot topic. You know, you've got people like Gary Brecka and even Joe Rogan talking about sleeping and breathing. So it's definitely a little bit more on the forefront, where people are like, oh, wait a minute, maybe, you know, this is something that might be going on with me. And so I have the really luxury of seeing people twice a year, whether they have anything going on or not. I mean, can you think of another doctor that gets to see all his patients a couple times a year, whether they have anything going on or not? So, and of course, when the hygienist has, you know, her fingers in your mouth, she has your undivided attention, right? She can talk for like an hour, and you can't even, you know, you can't even talk back. So it's and they, you know, and so they can see that, and so we don't tell patients, oh, we think you might have sleep apnea, because people are still thinking, oh no, that's that overweight middle-aged guy. They're not thinking that this could be even a condition. So we find that just asking those questions all of a sudden really brings forth conversations that once they start talking about these things, like, wow, I never even thought that these could be related. So we're kind of connecting the dots for patients. And so we have some really cool diagnostic tools in our practice. One is this 3D X-ray scan that we can do. You know, when I was a kid, remember when they go and they take the X-ray and they'd have the lead shields on and all stuff and run out of the room and you'd be glowing afterwards for a couple days. It's kind of cool, and we use a lot of German technology. It's really cool that we can take an image like this and even analyze patients' airways with probably less exposure than you would get from like a simple bite wing X-ray even a few years ago. There's not necessarily everybody in medicine and dentistry kind of wants to look at the minimum cross-section, which is basically, hey, what's the narrowest spot in that path down to the lungs? What we're finding out is that there's not necessarily as big of a correlation as you would think, but I look at the shape of the airway, and if you look at this airway, rather than being a nice, round, stable airway, do you notice the shape of that particular airway? And I call that the fire hose airway. So a fire hose, when there's pressure, incredible amount of water through it, but what happens as soon as you release that pressure, it collapses. And if you look at the tongue, would be sitting where that fire hose is. So when you lay back, it doesn't take a lot for that airway to get compressed and to cut off the air. And we now, for example, know that clenching and grinding, which is really, really common, has nothing to do with bite or stress. It's essentially a protective mechanism for you to keep that airway toned enough that it doesn't close up all the way. And it also turns out that clenching and grinding, those biting forces you're putting on your teeth, can be 4 to 5 times what you can do when you're awake. So if you're sitting there right now, bite your teeth together as hard as you can. In your sleep, you can bite 4 to 5 times as hard. So what do you think that does to your teeth? You know, do you think that me as a dentist, I can see the signs of that? You know, like all those people come in, you're like, yeah, I kept breaking things and all those things were happening and I was doing everything I was told to do, but I kept breaking teeth. And then you start looking, you're like, yeah, you're probably an airway patient. Even the tori, little bony growths in the jaw, again, a lot of pressure on the jaw responds by growing more bones, so we can look at all of these different signs. The other tool that we use a lot is this sleep image ring. This is essentially allows us to do a really high quality home sleep test. We're not going to get as much information as you would get, you know, say if you went to a sleep lab, but this is extremely easy to do. Essentially, my airway system downloads the app for you, and at night when you're ready to go to bed, you put the ring on, you hit the little green button, and in the morning you just hit stop, and then it uploads this sleep study to the portal. And what I like about it is some of these sleep studies are really, really difficult to read. You see lots of graphs and charts, and I like the fact that they break it down not just into sleep apnea, but also use all of the other parameters to kind of create a sleep quality index. Because I get people coming in all the time saying, yeah, I went in because I knew I had a sleep problem, and they did a test and they said I was normal. They said, I don't feel normal. It's like, yeah, because you're sleeping horribly. One of the things, for example, I'd look at is there's a little where it says RDI. You may have a little bit of a hard time seeing it, but that's called the Respiratory Disturbance Index. That's what's your body trying to do to prevent you from becoming a sleep apnea patient, because that's the end of the road. When you stop breathing, your body does not want to go there. So it's always using these protective mechanisms to keep you breathing. So that's the problem. When you have these respiratory disturbances, as you're going into deep sleep or REM sleep, these little disturbances are preventing you from reaching those, being in those levels as long as you should be. So you're kind of bouncing in that light sleep, which is what I call the junk sleep. So you're sleeping, but you're not getting the benefits of sleep. So how do we address that? And if you do want to learn more about this, by the way, is an amazing book. The doctor who invented the appliance that we're using in our office actually went to see him. And I was really upset when I read this book, because I'd been going to conferences for about 6 or 7 years and just never ended up putting any of this stuff into practice. And I was trying to figure out why I wasn't using this, and finally realized, like, wait a minute, it doesn't fix the problem, it's a Band-Aid. And so he was the first guy. I read this book and I go, really? I just learned more reading a book written by a journalist than I have in the last 7 years of going to medical conferences. But he was the first guy to ask about why. Like, why are we in this position where, you know, all the kids these days, they all need wisdom teeth pulled, they all need braces? You know, why is that? Our teeth aren't getting bigger, you know, so obviously the conclusion was that our jaws are getting smaller. And this is from one of his presentations. And that's basically as our brains are growing, even though sometimes I wonder if we're using them, our jaws have gotten smaller. And if you look at, like, in between the jaw, how it's getting narrower and narrower, and there's just less and less room for the tongue to go. And so when you combine that with some of the other things, and when you start looking at these profiles, this is something that you see really commonly now. You just, you know, once you recognize these signs and symptoms, as I'm walking around, you just go, oh, there's a sleep apnea patient, there's a sleep apnea patient, just even based on facial structures. And that's why we end up with crowded teeth. We end up with nasal cavities that are too small. We end up with jaw pain because our jaws are retruded and being pushed back because they don't have the room to come down and forward. And we have the constricted airways. So that's what I wanted to do. I wanted to fix the root cause of the problem. And this is essentially the appliance. It's called the HomeoBlock. And it's actually a very, very comfortable appliance. It goes on the upper teeth. And you essentially wear this appliance, you put it in at night when you go to bed, take it out in the morning. So it's very easy to do. And I went through braces. I hated having anything in my mouth. You know, I'd wake up 10 minutes later, whatever was supposed to be on my face or in my mouth was somewhere in the room, but not on me. And so I'm like, well, I'm gonna make one of these appliances just to see what I'm asking my poor patients to do. Well, I put it in. I thought, wow, this thing actually feels very comfortable. So what it essentially does is it does a couple things. One, it just has a block on one side. So it seems a little weird to put an appliance in where you're only hitting on one side. But think about it as kind of replacing the missing hard food in the diet. So when you're biting on that, it allows the sphenoid bone to move, which is a big butterfly-shaped bone that houses the pituitary gland and releases growth hormone, you know, in the middle of the night. And it's almost like doing craniosacral therapy. It allows all of the cranial bones, and it helps with what they call primary respiration and the flow of cerebrospinal fluid. The appliance also has a little gap underneath, and it flexes, and those little flap springs put light cyclical forces into the teeth, and that stimulates the production of stem cells. And so that's what our body responds to. It doesn't respond to brute force. It responds to, you know, breathing, chewing, swallowing. Those are all these light cyclical forces that trigger the body to grow. So our bodies generally don't like things like braces because we're just using brute force to move the teeth, and plus we're moving them to where we decide they should be, and we have no idea where they're supposed to go. This will stimulate your body to essentially grow your teeth to where they're supposed to be. And we have this little expansion screw. So you can see it's working, because what happens is, as you wear this, about every 3 weeks or so, you put a little key in there and give it a turn, and it expands that appliance by about 1/4 millimeter. So it's similar to what we do with kids, but it's also the opposite. Like with kids, you're turning that key and you're pushing, and you're actually forcing those teeth apart. With this, we're signaling the body to grow, and then the screw is to keep up with the changes that have already been created. So you're kind of chasing those changes. And what's cool about it is that when you get to the point where you turn the key and it fits tight, that's where we stop. We've just signaled your body to kind of grow where it needs to do. So this appliance creates strain. So as you're chewing, it puts strain throughout the whole mid-face, and that's basically how our bodies grow. And Dr. Balfour always said, without strain, there's no growth. And it kind of starts with, there was a period of time when a lot of kids weren't breastfed, and I still consider, doctors telling moms that bottle feeding is as good as breastfeeding to be the single dumbest statement in medical history. And it's not just, and here's the thing, it's not just, we tend to think of nutrition and mother's milk going hand in hand, but we don't always think of the forces that are applied. And they've known, this was in the journal Functional Orthodontics in 2001, that the breastfeeding forces is what causes our faces to grow. So we have a problem. It's like the OMG problem: ovens, microwaves, and green drinks. Our food keeps getting softer and softer, and to the point where we've almost turned into two-sided chewers. We're not creating that strain anymore. So our faces aren't growing the way they're supposed to. And so there's a process called epigenetics. We have our genes that determine what we're going to look like. Epigenetics is what are the external forces that change how those genes are expressed. And this is actually from Weston A. Price's book. This was in a couple of Irish identical twins. This was, I guess, they were just starting to have more foods that were a lot of candy and things. And look at these are identical twins, yet their faces look completely different. So essentially, the appliances we're using are epigenetic appliances that are still triggering your body to express your DNA more optimally. And we have patients in their 70s and 80s that are getting phenomenal results, because that's what people always like, oh my God, I'm 30, this isn't gonna work on me anymore. I'm like, no, this will work on you for a long time. So essentially, the three main mechanisms, I already showed you a little bit about the appliance, but it helps remodel the upper jaw. And really how Dr. Balfour discovered this was he had this practice in New York with all these performing artists in the 80s, and a lot of them would want some teeth straightened, but that was the days before Invisalign, so it was either full braces or nothing. Well, he found this orthodontist that was using these removable appliances. And so his patients would come back and say, hey doc, my makeup artist is telling me my face is changing. My cheekbones are growing. My jawline's more defined. I'm hitting higher notes when I'm singing. So that's what prompted him to look into this. And there's actually a software package developed by the Mayo Clinic that you can put in 2 scans, and essentially it finds out the changes in volume. So he was able to show that wearing these appliances, we in fact could grow bone and grow the jaws. And so that's what prompted him to really go down that path of learning more about and developing this homeo block. The other thing that's really cool, because you have that block on the one side, the appliance does force you to swallow correctly, so you have to lift your tongue that extra 1/4 inch or so. So you're essentially toning the muscles that support and dilate the airway. And Dr. Balfour always said, all the doctors I study with, they all seem to have all these little sayings, but they're kind of funny. But he always said, like, this appliance, it's like taking your tongue to the gym. It's funny, I had a patient, he was like this muscular guy, he always worked out at the big Lifetime Fitness. I said, and he had horrible airway. I said, yeah, the problem is at Lifetime Fitness, they don't have a machine to exercise your tongue, do they? So that's essentially what we're doing. And then the other thing is just down-regulating your autonomic nervous system. Because when we're in that fight or flight condition, our bodies are just programmed to survive the next 5 to 10 minutes. It's not thinking about detoxification and regeneration and all of the things that should be happening in your sleep. So getting people into that parasympathetic is really critical. And essentially one of the ways, so we want to turn them from that freaked out marmot into a nice, chill, relaxed. So that's what we're trying to do with our patients right there, in a nutshell. But yeah, that's, I compare our bodies to these amazing race cars, and when you're in fight or flight, you're on the racetrack. If that race car never pulled over for service and maintenance, it wouldn't just be a matter of, if it's going to break down, it's just a matter of when. And that's kind of where we are with our bodies. We're on that kind of perpetual racetrack. So, like I said, it's a very comfortable, I actually called the Homeo Block the adult pacifier. My office manager had one too. She calls hers the snooze button, because when you put it in, it also stimulates part of the vagus nerve. There's some innervation of the vagus nerve on the palate, so it does have that calming effect. So it's part of a protocol. It's not just one of these things where we say, here's the magic appliance, this is going to fix all your problems. So we work with a number of different things and other procedures in the office. One of the things is we do a laser procedure where it's called night laze. It's designed for snoring, but we found that we can also tone the floor of the mouth and the soft palate to improve breathing. We're also doing clear liners that aren't just lining up teeth, but in fact like pushing the teeth out and creating that proper room for the tongue. And then we also work with a lot of different therapists. We, if you have allergies and you can't breathe through your nose, well, that's not going to be real good for nasal breathing. Myofunctional therapists that help tone the tongue, and then there's a group of chiropractors and physical therapists that are called PRI. It stands for Postural Restoration Institute, and they also focus on how sleeping and breathing or how posture and proper breathing can help your sleep. So, what can you do right now? Obviously, after hearing all this, you're like, okay, I need to figure out what to do about this. Well, the nice thing is we have a lot more ways of measuring what's going on with our sleep, so we're definitely much more aware. And by the way, just the numbers that you get from these appliances, I've gone through times where I've worn 3 or 4 at the same time just to see how accurate they are. And the numbers do kind of tend to be all over the place, but if you stick with one and use that as a baseline, it can be a really good tool. Just good sleep hygiene, getting up in the morning, getting some morning sun, preferably getting your feet on the ground, blocking the blue light. That affects melatonin production for about 90 minutes after you go to sleep. And then just having good sleep conditions. I also love some of these sleep aids. That mask, most of the masks just have that little elastic string that you never know if it's supposed to go above or below your ear, and it kind of, this thing is awesome. It's like $10 on Amazon, but it's much more comfortable. It kind of gives you that really nice dark look, and it has a very soothing, comforting feel. The nasal cones, very similar to the old Breathe Right strips. And if you ever want to see if it would work for you, it's called the coddle maneuver. You just put your fingers on either side of your nose and pull apart, and then pull, and then just see how different your airflow can be from that. I like the Dream Recovery mouth tape just because it's elastic, so people can open their lips and breathe through their mouth, but then it pulls your lips together. Sleep supplements. You guys probably know alcohol is not a sleep supplement. It makes you fall asleep. I know, darn. It helps you fall asleep, but it does affect your sleep quality. I like the GABA with the L-theanine and also CBD. We find that helps a lot of our patients that have a hard time falling asleep. And then my buddy Otto, I would have never guessed how important some of the things that he's done for me. I mean, when you go to sleep at night and your brain is racing and you have all these things going on, so there's definitely a big, psychological and there's so many components to sleep, and he made me kind of realize just how important it is what you do. So, thank you, Otto. And now let's see. I don't know if this is going to play or not. No, it's. He basically talked about, again, how he had a whole month of perfect sleep, and again, just kind of putting the emphasis that we really need to look at our sleep and put more emphasis on that. So, I have a practice about just a couple miles from here. So, we're fortunate to be in a really great area where people are aware of these issues, and we try to help them with it. I have a couple little books in the back. This is my website. If you scan that QR code, you can also download that book as a PDF. So that is it. Hopefully I didn't go over too much. I was trying to go as fast as I could. Thank you. Your Q&A? Yeah.
So we have time for questions. Who wants to go first?
I'm usually just so good at giving information that everybody's like, this is totally clear to me.
Well, I actually have two questions.
Okay.
So first will be because you talk about braces, and I have an 11-year-old that she just started on braces like 2 months ago. So, but she also has this airways issue. And so will the expander that she has now help a little with the airways obstruction?
Yeah. You definitely want to go to an orthodontist that is aware of airway issues. There's a new group of orthodontists that call themselves patient-centered orthodontists. So it's a really great concept. These are the orthodontists that understand there's actually people attached to the teeth that they're straightening. So, because everything tends to be pulling things together. You know, you have crowding. Well, let's just pull a tooth and then line up the teeth. So now there's a lot of orthodontists that are realizing, wait a minute, we have to push things out and create that room for the space for the tongue.
Oh, nice.
Yeah.
Anyone else? Because I have another one. Okay.
Love it. I have a girlfriend who is actually talking about her son is 15. He's got ADHD. He doesn't weigh that much. He's getting terrible sleep. And so you talking about this made me think that that's probably most of the problem there. Can you touch a little bit more on, I know you talked about like depression and anxiety, but what you see in children and how it affects the ADHD when they clear up the...
Yeah, I mean, you know, you think about what's happening to these poor kids and a lot of parents will share that they can hear their kids grinding their teeth from down the hallway. That's them trying to keep their airway open. So not only are they not getting proper oxygenation, they're not getting proper sleep levels. And then in the morning, they go to school and they're supposed to sit at a desk and learn math. You know, and then we label them if they can't sit still. So there's also a lot of, with the REM sleep, there's a lot of balancing of neurotransmitters, there's storing of memories. So there's a lot of components to being in those proper sleep levels that affects every facet of their life.
Anyone else? Laurie here?
Hi, thank you. Very good presentation. I learned some things.
Thank you.
And so my question is, if I went to my dentist in 6 months and said, would you check my airway? Would they know what I'm talking about?
I'm working on that, but unfortunately, right now in dentistry, probably 98% of the appliances that dentists are using are what are called mandibular advancement devices. So they may do a sleep test on you. If you have an issue, the gold standard for treating sleep apnea is a CPAP, and then if you don't tolerate a CPAP, the next appliance is essentially what they call it's a jaw advancement appliance, so you're sleeping with your jaw forward to help the jaw and tongue from dropping into the airway. The problem with those is they're a fairly good Band-Aid, but 12 to 18 months in, every morning you have to wear a tooth repositioner so your teeth fit together and your jaws line up again. Well, you do that every night for 18 months. Guess what? People come back, they have joint pain, their teeth don't fit together, and it creates a lot of problems.
So I have one more question. I don't usually have any. And so I have one more question, which is that ring apnea looked like a really good apnea monitor in a way that you said about the sleep, the apnea monitor. Is that covered by insurance?
You know, we do this sleep test very inexpensively. We have, I buy a fair amount of these sleep image rings, and they have a new one that goes on the fingertip. And we do a 3-night sleep test for like $99, and you get to keep that ring. And that data is very accurate that's FDA approved. So compared to like the Oura Ring and some of the other rings, so it's good information. And we try to make that. It's almost like, you know, when you go to the dentist and they put the little blood pressure cuff on you. It's a good screen. It's a great screening tool. We're again not making a diagnosis, but when you see the data and you see that sleep test, it makes you go, yeah, this kind of explains why I've been feeling the way I've been feeling.
Next.
Yeah, thank you, Ingo. Excellent presentation. I have a little testimonial. because I wear the Humio block since February. Yeah. And the whole protocol is just amazing. In beginning with the sleep test is more precise than anything I ever saw. And I use one ongoing anyway, a ring. But then also the tool itself, first it's very precisely adjusted from himself or his assistant. And then it's really gentle. It's nothing that pushes the teeth apart. Yeah. But after 1 week, I felt the deep sleep phase of my ring was much longer. And that stayed that way. So there's a consistent going on in the body. Mm-hmm. Right. And also what you explained with the long-term effect on the sphenoid bone, that is profound because the hormone glands on the other side of the sphenoid bones regulate practically everything in the body. All the other hormones, it's a master hormone gland. Mm-hmm. So, and this Humio block in the beginning is like awkward. One thing is higher than the other one, but it keeps really the saliva flow going immediately, and it keeps a deep, regular breathing pattern going on. So whoever invented that is definitely a genius, mm-hmm. and I'm glad you picked up on that and put it into action to integrate it in your dentistry, because I feel that's where it belongs. Because today in your presentation showed so clearly how oral health affects everything in the body. On a high level, we know this, but how it exactly happens, this is such a brilliant example, both for short-term effect and for long-term. I think it's a valuable tool to have. I'm privileged to be on your program, so thank you.
Thank you. You know, it's kind of funny because years ago, I started down, I was like the little Doogie Howser DDS because I was practicing dentistry at 24 and I looked like I was like 12 years old. And people would always go like, what's your secret? And I just jokingly one day said, I sleep good and I poop good. I didn't even I don't know, for some reason it came in my head. I'm like, and you think about like, if you sleep well and you're eliminating properly, it tells you that your body's in parasympathetic, and that's when all of the good things happen. So I think intuitively, when I have conversations about this, people just, you see the light bulbs going on and they want to learn more, and people walking by going, I couldn't help but over here. So it's something that really resonates with people. So.
Yeah. Nice. One more?
All right, thank you. Thank you for your presentation, and thank you for the little factoid on your comparison study of the different monitoring devices. Yeah. I was wondering, which ones did you monitor?
I did a Whoop band, I did an Oura ring, I had a Garmin watch, and I was wearing a sleep image ring. So I just thought, well, let's see if because when I was wearing the Oura ring, I always felt like the deep sleep number read really low. And I go, really, it's only 10 minutes? I felt like it was better. And then that same night on my Whoop band, it showed that it was like an hour and 15 minutes. So yeah, we tend to kind of go, this is the number, but you just have to be careful that it's not.
Yeah, consistently using one device is a very good recommendation. I do have a question. It's regarding right side and left sided sleep. So I feel like for myself personally that I sleep well both ways, but I'm told that I snore more when I'm sleeping on my right side. And so I'm just curious, would your imaging study with the CT, would that help? Is it going to contribute to the question of is right-sided or left-sided better for you as far as your health and your sleep?
That's a really good question. Generally, sleeping on your back is probably the worst position, just because gravity's working against you. So,
I don't do that.
And we all tend to think, you want to have a really firm mattress. Actually, you want to have a soft mattress that allows your hips to sink in, and have a firm pillow that keeps your head level, and then sleep on your side. Now, the one shortcoming of that sleep image ring is it doesn't give us positional data. So there's some sleep studies like the watch pad that actually tell you if you're sleeping, what side you're sleeping on. And then you can break down that data and say, I had this many apneic events when I was sleeping on my right side, left side, back, and it breaks it down a little bit more. So we're not able to do that with the sleep image ring, but generally they even make shirts. You go to these sleep conferences that have, some people just sew tennis balls in back, but it prevents you from sleep. When you try to lay on your back, it kind of bothers you, so you end up flipping on your side.
Okay. I wasn't sure if your diagnosis of the fire hose airway was significant in that.
Yeah. So that's exactly what I look at. Is I look more at the shape. There's a bone called the hyoid bone that just looking at the position of that tells me if it drops below a certain level, it tells me that there's a good chance that you're obstructive sleep apnea patient.
Okay, thank you very much.
You're welcome.
And one more question, Dr. Mann. Will mouth guards help with your jaw dysfunction? Or?
You know, the problem with mouth guards is they're good at protecting the teeth. The problem is, though, a lot of them take up more room for the tongue. And so they actually force the tongue. A lot of people, you know, I used to make mouth guards for people and they'd come back in 3 months and they'd show me this piece of plastic that they've destroyed. So if anything, it can trigger more clenching and grinding. And it can protect the teeth, but it can make sleep worse.
Oh, wow. Yeah. Danny.
Yeah, wow, thank you so much. Fantastic presentation and information. I think my mic is on, though. Hello? Is it? Am I on? Okay. So, you know, you mentioned in the beginning, I think this sounds really, that this device is extremely good for longevity because it increases the sleep patterns, of course. And I found myself, sleep is probably number one, you know, and foundational health and longevity. So you mentioned also that you have a small little exam that you fill out that you can if I understood you right, that you can determine whether you need this device or not, or what you do need. And then you also have this test you can put on your finger to monitor your sleep for 2 or 3 nights. So is this something that you would do both of those to actually get a real good clarity of if you need this device or not? And would this device just be something that most everybody maybe should do because everybody has some issue or not?
That's a good, kind of like all the patients that come through our practice, the hygienist, when you get your teeth cleaned, they put the little blood pressure cuff on you just to do a screening. And with that, we're essentially doing the same thing. We have everybody fill out that impaired mouth assessment form. And then we try to make it, again, very reasonable. For $99, you can get like a 3-night sleep study done. Because it does, when you see it when you see the little red squares, you're like, okay, there's something going on here. And maybe I'm not, you know, being asymptomatic doesn't necessarily mean that you're doing well, that, you know, when you're on that spectrum. So the earlier you can discover these things, the easier they are to treat and the more successful we are. Because if you wait until patients are really severely apneic, that, you know, at that point we still say you need to go see a sleep physician because, you know, it can be life-threatening, obviously.
Would we access that sleep study, for example, through online or through your office directly?
We have sent patients those sleep image rings, but generally what we do is we do the screening when they come in for the kind of the regular checkup when they first become patients.
Well, so you make an appointment with your office and then.
Exactly, and if we see a problem, then we give them like the little book, say, hey, learn more about this, and then we do what's called an airway workup, where we do sometimes more imaging, just get some more information. Because we're really trying to figure out, it's not just one thing. So we're trying to assess: is there a tongue tie? Are there allergy problems? Are there, you know, it can be such a multifaceted thing that we really want to make sure we're addressing all contributing factors.
Yeah. Okay. The other part of that question was, is that would this be a valuable tool for almost anyone to use who's interested in longevity? I mean, you're talking about improving airways. Most everybody has something in their airway, improving, you know, the facial muscles and bone structure.
Kind of the joke is that James Nestor talks about how it's almost like a holistic facelift. So
well, there you go.
It's like basically we say, well, if you and so we've had patients come in just because they wanted the aesthetic benefits. It's like, well, the side effect is going to be you're also going to sleep better, and if you're doing it for sleep, you're also going to look better. So
well, you see people who get older, you know, they begin their faces begin.
Right, that's where we age is in the mid face. That's where we lose. That's where we lose bone.
Yeah. So it might be something that you could say that everybody who's interested in longevity should possibly maybe utilize this tool.
Right. Well, again,
there's no harm in it, is there? I mean, in other words, there's no harm in it.
No, and I just spoke with Dr. Balfour's wife yesterday, and we were having conversations about some of his comments, and he said, that's the nice thing about this. It's a signaling appliance. We're not deciding or forcing anything, and anybody
right.
can put this in and get better sleep. And so anybody on this, and that's what I love, is the fact that we're not saying, you got to wait till you get to this bad point, and then we've got, I mean, why do they wait that long? Because essentially the CPAP is a really, really crummy solution. You're just forcing air down into the lungs. You're not getting, the sleep quality on patients that are doing these sleep studies is horrible. They're not apneic, but their sleep quality is horrible.
Yeah.
So that's the great thing about this appliance. Anybody can wear this, and it's going to calm down their autonomic nervous system. It's going to tone the muscles that support the airway and kind of prevent you from, as we get older, we lose muscle tone anyway. So this helps with exercising the tongue and preventing you from going down that path.
Understood. So we first had this conversation, when I first had it with you a couple months ago about this device, you also mentioned maybe you want to go there or not. You also mentioned maybe you would have some special for people unlimited on that, if I understood you right, on this appliance. Do you want to talk about that a little bit, or is that something you'd rather?
Yeah, if you come to our office, I've already, one of my missions is, when I first learned about this company had a similar appliance, and they charged dentists these ungodly amounts for education. They were overcharging the dentists for the appliances, so these dentists were had to charge $12,000 to $15,000 for this treatment. I'm like, no, I want to help people breathe and see as many people benefit from this. So I do it at a much lower cost than that. It's basically about $5,500 for the whole year program, and I would do
very reasonable.
Yeah, and I would actually do a $500. I was thinking about what we were talking about, and I would do like another $500 discount if you just come in and say you're People Unlimited.
Nice.
Help you with that.
Thank
yeah.
you. Jean, you had something? Go ahead, Jean. She's bringing the mic there, I think.
Are you done? Okay. So just two questions. One, if someone's already on a CPAP, is there a potential for someone to be able to get off the CPAP?
Yeah, we have a lot of patients that come in, they want to get off the CPAP. So the nice thing is you can wear this appliance while you're wearing a CPAP. I just had a pilot. He can't wear CPAP, and he was about to lose his job. And so we did the airway appliance on him. We did the laser procedure. We retested him. He got much better. And I wrote a letter to the FAA, and they were like, "Okay, you're good to go." So, yeah.
And then do you also take care credit?
Yes, we do. And we even have one now, Cherry, that's like Care Credit, but instead of 12 months interest-free, it's 18 months. Oh, yeah. So
that's great.
We're always trying to figure out how to make this affordable for people, because it's like, you get excited about these possibilities, and it's like, well, what good is it if you can't afford it? So we're always trying to help people work this in their budget.
That's all. One more question here.
Just last question.
Yeah, last question here.
I'm curious. So I actually have really good numbers with my Whoop for sleep, but I do feel like me and Alana share this, is that we tend to notice that we don't breathe well during the day, and I don't know if that's just something mental or something like that. But I was curious if maybe this device might help breathing during the day. I know that you're wearing it at night, but then
you can wear it during the day. There's not that much additional benefit, but for patients that have really poor muscle tones, initially I'll have them wear it more often, because one of the things that we do to breathe better is, well, if you do the shallow chest breathing, it puts you into this sympathetic mode, and you're blowing off all the CO2. But we also adopt different positions, like a forward head posture. So you see people, again, it's just an adaptive mechanism to keep the airway more stable. So if we can help you with that, and in those cases, we'll work with chiropractors or physical therapists when we see that, so they can help you. Because if your body says, I breathe better here, and your chiropractor puts your head here, guess where your head's going to go the minute you walk out the front door? It's going to go where you breathe better. So, but if you do it in conjunction and you're fixing the airway and you're working with a chiropractor or physical therapist, it's a really great synergistic therapy.
All right.